Hi, my name's Ryan. I'm 29 and I'm scheduled to have a L5 S1 360 spinal fusion. I'm creating a diary for my road to recovery. I'm actually going to read my story that I typed out just for this episode. That way, I'm sure I don't miss anything. Um, After this episode, I won't be reading, and it's just going to be snippets of my journey. And I'm a little camera shy. It's my first time being on camera. So here goes my story. I've been diagnosed with spinal stenosis and a degenerative disc that is herniated, which is also putting pressure on my nerves. I've had back pain in this area on and off for 10 years now. Most of the time, the pain would flare up if I was standing for long periods of time or doing strenuous activities. It would ultimately press on my sciatic nerve and cause shooting pains down my left or right side, starting at my lower back and going just about to my knee. It would last for a few days and then go away for months, and then it would just come back. I treated this with chiropractic care, which was helpful some visits, and other visits would re-trigger the pain. In May of this year, I woke up to my back hurting again, but this time it was much stronger than I ever remembered. I had difficulty walking or standing, and in certain positions, it would cause shooting pain down my left side. I decided to schedule a visit with a doctor's office that specializes in disorders of the back. Of course, the first question I was asked by the doctor is, what did I do to injure my back? I did nothing that I can possibly think of that would have caused this, and since it's been on and off again over the years, I'm guessing it's my body's way of telling me it's time to actually get this looked into. The doctor sent me for an x-ray on my first visit that showed I have a 5 millimeter disc bulge at the L5S1 level. Then the doctor advised me the best route would be to rest, which wouldn't be a problem since I was having difficulties moving. They also suggested I take a 7-day dose of oral steroids and start on a daily anti-inflammatory and follow up in 2 weeks, and then we'll see how I'm feeling. I completed the doctor's orders over a 2-week span with no change in results. The next step was to complete 6 weeks of physical therapy, 2 times a week, and she also provided me Ultraset for my pain. I hated physical therapy. Every session, I was just in so much pain. The day after therapy, I could barely move. After the 7th visit to physical therapy, the therapist told me that I should be getting somewhat better, and therapy is really not helping me. It's only making my condition worse. So the next day I went back to the doctor since the therapy wasn't working, and the doctor actually suggested that I try facet injections on my left side of my L5S1. So I went for the facet injections in the beginning of July, and the day after the injections, I was in more pain than when I first went to visit the doctor in May. I couldn't sit. I had this ball of pressure in my lower spine is really the best way for me to explain it. It was just a deep, deep pain. And I couldn't get any relief unless I laid down. So of course I called the doctor back and I explained the pain that I was feeling. So they provided me with a prescription of 10 milligram Vicodin and sent me for an MRI. And they said I should try and also do an epidural injection on the left and right side of the L5S1 disc level. So the MRI showed my L5S1 black as night with stenosis, and of course, desperate for relief, I went to get the epidural steroid injections, which were in August, and still no change in my pain. And the Vicodin had started making me sick, even if I was taking it with food. And it was just sporadically. Sometimes I would take it and I'd be fine. And then, 6 to 8 hours later, I'd take my next dose with food and I would get sick. And I was like, this isn't going to work. I don't, right now, I've only got the option to either be in pain or to be sick. And honestly, the pain medication wasn't doing its job. I work in an office, sitting 8 to 10 hours a day. And at this point, my body would not allow me much pain relief unless I was laying down. I had to get up every hour at work and walk, which was also painful, but walking created a different pain. Walking caused my nerve pain to start acting up more, shooting pains that moved from my left lower back, down my leg, and all the way to my foot. And randomly it would switch sides, and I'd get the same pain with my right side. So I went back to the doctor, who recommended I go to the orthopedic surgeon who practices out of the same facility. So I scheduled the visit with the surgeon, who basically told me, I see you're in a lot of pain. I can fix you, but I need you to understand that it's been very difficult for us to get patients approved for a spinal fusion due to the many changes the insurance companies have been making, and will need to gather more evidence to prove your case. Ultimately, she told me my only option was to do the spinal fusion or just to continue on. So I went ahead and, of course, agreed to, move forward with those decisions to be able to prove my case. So they also let me know that after completing the steps to try to prove my case, that insurance might still not approve my surgery. So I just went ahead and I did the steps that was needed because I was just at the point where my work was affected by my pain. And I ended up, I just laid down most all the time that I wasn't at work. I was laying down. My mother, my boyfriend, my 5-year-old daughter, they had to help me around the house. My quality of life, it just wasn't good. So, I was to the point where I was feeling like, this is also affecting people that are around me. It's not just me. Of course, since I have my daughter, I need to be mobile, and I'm not. So the next step was to get another steroid injection. And that was actually a steroid injection in my SI joints, just to rule out any issues with my SI joints. So I got the SI injections in September, and I experienced no relief from those either. The final step was then to have a discogram. I went to have this test done, and I did experience pain off the charts during this procedure from my L5-S1 disc. If anyone's had a discogram that's watching this, you know what I'm talking about, especially if that was the level where the problem was. Of course, the level above my L5-S1, my L4, L5, no problems. It just felt like fluid going through my disc, but that discogram wasn't a joke. All right, so I scheduled a follow-up with the surgeon in the beginning of October after my discogram had been completed, and I was so excited for my appointment so my surgeon could submit all my results to the insurance company, and I'd be one step closer to that path of pain relief and back to a semi-normal life. The visit with the surgeon consisted of her telling me, yeah, we were right, you do need the spinal fusion, just to get the option of the pain relief. But there's no point in me submitting your paperwork over to insurance because they're just going to decline the surgery for you anyway. And even a peer-to-peer meeting with them will not be helpful in obtaining approval. Plus, if she submitted the claim, it would take a minimum of 6 weeks for them to deny my surgery. And I'd be waiting for nothing. So my only option, she said, was to continue the way I was in seeing a new pain management doctor, because during my last steroid injection and my next visit with the surgeon, the drug classes have changed. So they were no longer giving out any narcotic drugs, just because their schedules wouldn't allow for patients coming in just for refills, because you have to have a paper prescription for the medication that I was taking. Anyway, so of course, at this point, I was taking 10 milligram Percocets every 6 hours, and they're only allowing me to partially function at my desk job, where my performance is on the downfall, not to mention my life outside of work. I was crushed because I took all the steps required for the approval. I spent large amounts of money just to get to that point to tell me, yeah, we can fix you, but insurance isn't going to pay for it. So really we can't. Um, anyway, so I decided to go home and do something that I haven't done in years. Years before I even had this pain, probably 15 years. I decided to go home and pray. And I prayed and prayed and prayed. And I went to bed. And then the next day, I decided to take another last step to locate another orthopedic spine surgeon in my area and make an appointment. I was like, you know what, worst case, he's just going to be like, hey, yeah, your surgeon was right. There's not much we can do. Insurance isn't going to pay. You'll have to pay out of pocket, which is buku's the money. So just continue on. So I went ahead again. I made that appointment just because, again, I'm not willing to accept that I have to live like this. There has to be someone who is able to work with the insurance company and is willing to help me and my family instead of just tell me all hope is lost. Someone who just still cares. I had my appointment with my new chosen surgeon on November 3rd. I brought my MRI, my Discogram results, and they also took another x-ray. I met with a surgeon who told me the previous surgeon I saw was correct with my diagnosis, and really the only option for the potential fix in my condition is that spinal fusion. The difference in this meeting with this new surgeon was he cared, and you could hear it. You could tell either that or he puts on a really good act, and I bought every second of it. He told me, don't lose hope. I'm going to help you. We'll submit everything to your insurance. I'll write up what I need to. I'll do a peer-to-peer if that's what it takes to have this approved. I was so happy to hear that all hope isn't lost. I was so happy, and I limped my little happy butt slowly out of his exam room just to a scheduler. I went ahead and set up my potential surgery date for December 2nd. I was told to wait about 2 weeks for insurance to come back with a response, and I actually interrupted the assistant and said, wait a minute, 2 weeks? What do you mean 2 weeks? I was told it's 6 weeks, and maybe even then I'm not going to hear anything. And her response, she just smiled and, was like, well, normally it's sooner, but in this case, we like to just give a 2-week time frame. That way it allows the surgeon time to speak with who he needs to speak with at insurance if they're not going to approve based off of the documentation that's been sent over. So I was just happy as a clam. I was shocked that I really even wasted my time with the previous surgeon. But the assistant, she said they'd set up for me to go to a pain management clinic within a few days just to get refills on my pain medications. There was nothing that I needed to do on my end, and I just waited. It felt much longer, but exactly 2 weeks later, I spoke with the surgeon's scheduling assistant who advised that insurance approved my surgery, and I am still scheduled for my L5-S1 360 spinal fusion on December 2nd. I am also going for my pre-op test on November 24th. And also, everyone that's viewing this, I wanted to let you know, originally I wasn't going to do a diary because, well, I'm not one to be caught on camera. There's so many different videos on YouTube of people that are going through this. So I just didn't see the point in why would I go through and, do a diary of, who's going to take the time to view it. And not only that, is my story really going to impact somebody? And I started thinking about it, and, the situation, it's different for everyone, this situation. And honestly, if I can just help one person that's going through a similar situation, and let them know that there is hope, things will start to look up. This diary will be worth it. Just place your faith in God. If you don't pray to God, then whatever higher power you believe in, put your faith in them. They're going to get you through this. Even, through all this, He's been there for me. I've had a great support group. Everybody, you've got to surround yourself with people that are going to help you through this and, provide you support. And again, pray. Just pray. I don't know if I'd have got through, even where I'm at right now, without starting to pray. Anyway, I know this has been a long video, and it is going to also be a long road to recovery, but I'm glad that I do get to start my journey, and I'll try and keep you updated as I go. And I'll be back, of course, before my surgery. Again, I have got my post-op, so I'll give you an update after that, and try and include a list of items that I think I'm going to need for surgery. I've kind of been looking at other people's lists that have had the surgery, and I've been kind of compiling them together, getting what's going to be beneficial for me, at least what I think is. But anyway, have a good one, and thanks for listening.